Number 6, the Honourable Annette King.
Oh, I've got a question, Mr. Speaker. Yes.
Order. Order. The interjections now are coming from both sides. I ask that it cease. The Honourable Annette King, question number 6.
Mr. Speaker, my question to the Minister of Health. What dollar increase in core Crown health expenditure is required to meet all demographic and inflationary cost pressures in 2016-17?
The Honourable Dr Jonathan Coleman.
Mr. Speaker, the technical costs for population ageing and inflation for any given year are never known until that year is completed. The member should know that core Crown expenditure is a different measure from Vote Health, which is the main measure that is used for health spending. Vote Health funding shows that health is up by $4 billion under this government, which is above population growth and inflation. The member knows that there is not a single health service that hasn't improved over the last 8 years. I suggest that Labor focuses on services and outcomes rather than calling for more spending and higher taxes.
Supplementary question, the Honourable
Well,
Annette
in
King.
light of his answer that we have to wait till the end of the year, what percentage for demographic cost pressures did he use to give DHBs their funding indication for 2016-17?
The Honourable Dr Jonathan Coleman.
You're just going to have to wait till the budget, one sleep to go. You know that.
Supplementary question, Mr. Speaker.
Supplementary question, the Honourable Annette King.
In light of the public criticism last week by General Practice New Zealand at the chronic underfunding of practices, quote, will he ensure General Practice receive the extra 20 to 26 million they are seeking to meet all inflationary pressures, or is he happy for doctors' fees to rise?
The Honourable Dr Jonathan Coleman.
Look, Mr. Speaker, unlike the member, I get around a lot of general practices and I'm getting very good feedback from doctors who are actually doing the work on the ground as opposed to Labor Party members who might work in the health sector.
He's so weak.
Supplementary question, the Honourable Annette King.
Will the budget address the Orthopaedic Association's concerns, who said recently patients waiting for surgery were sicker than once was the case and they had two options, pay up or wait until their hips and knees got worse?
The Honourable Dr Jonathan
Speaker,
Coleman.
the orthopaedic surgeons are actually very happy because we're doing an extra 6,000 orthopaedic operations per year compared to when we came into government, an extra 2,000 hips and knees, there's an extra 110,000 appointments right across the system and an extra 50,000 electives to go with the extra 6,000 doctors and nurses. So actually, the feedback from the orthopaedic specialists has been very, very good.
Supplementary question,
Supplementary question, the Honourable Annette King.
When he said last week that people were getting access to mental health and addiction services they need, was he aware that he was using misleading data because 70% of 44,500 young people in 2015 did not receive help in 3 weeks as he claimed? It was 70% of 15,000.
The Honourable Dr Jonathan Coleman.
Mr. Speaker, the master of misleading data is Mrs King. The fact is, in 2015, 70% of young mental health patients were seen within 3 weeks, 91% seen within 8 weeks. 4 years ago, only 2/3 were seen within 21 days. So actually, we're seeing more people, seeing them quicker. The service is a lot better than when Mrs King was running it.
Point of order, Mr. Speaker.
Point of order, the Honourable
Mr.
Annette
Speaker,
King.
I seek leave to table a Ministry of Health document taken off their policy priority webpage entitled PP8. Very hard to get access to.
If it's available on the website, members.
Well, the Minister didn't say it.
If it's available on the website,
Supplementary question,
members
Mr.
can get
Speaker.
it. Supplementary question, the Honourable Annette King.
If he used the demographic cost pressure of 2.7% and inflation of 0.4% as of March, would the increase in core Crown health expenditure need to be at least $600 million in budget 2016-17? If not, what should it be?
The Honourable Dr Jonathan
The
Coleman.
member is confusing core Crown health expenditure with Vote Health. So core Crown health expenditure includes various elements of ACC, part of the workplace and safety vote, bits of the health vote. Actually, she fundamentally doesn't understand the structure of the vote. Very surprising after 30 years in Parliament, but true.
Order. 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 Question number 7, Simon O'Connor.
Thank you, Mr. Speaker. What progress, this is to the Minister of Health as well, what progress has been